السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله. I am Mohammed Al-Hajjar of AMANI Birth. I would like to welcome you to this presentation on exploring the birth options, avoiding cesarean section.
And I'm Aisha Al-Hajjar, and we're here together coming to you from Saudi Arabia in honor of World Cesarean Awareness Month.
We will talk today about why are we here, and why to avoid cesareans. We'll have some definitions and how to avoid cesarean. We'll explore VBAC and talk a little bit about childbirth education.
So why are we here? First of all, we know that you care about your family. You're curious about your options. You want what's best for the mother and the baby, and you're responsible for the welfare of your family. We also know that your company knows that this is important.
I used to think that birth is a woman thing. Participating in my wife's natural birth changed my life. We both co-founded AMANI Birth to assist mothers for active natural instinctive birth. I recognized that the birth experience matters and impacts the mothers, the baby, the family, and the community lifelong. I truly believe that our communities need to know the truth about their options. So why do we avoid cesareans? Cesarean is a major abdominal surgery.
That's right. And cesarean recovery takes longer, impacting workflow and income. For example, in the United States, did you know that the law allows 4 weeks off for a normal birth, but 6 weeks for cesarean? That's because they're acknowledging that cesarean takes longer to recover from.
And also the cost. Medical cost of cesarean is more than vaginal birth. Here in Saudi, vaginal birth costs 8,000 riyal. It's 20,000 riyal for C-section.
Wow, that's over double.
And the risk of maternal complications increases with surgical birth. Repeated cesarean greatly multiplies the risk of successive surgery.
Of course, and also for the baby. The baby loses benefits of passing through the vaginal canal. Beneficial vaginal flora produces healthy gut flora in the infant. This is lost in cesarean birth. There's also the tight passage of the birth canal which squeezes the baby. This produces a fetal Heimlich maneuver, expelling the fluid in the lungs and allowing for ease of infant transition to lung breathing, also lost in the babies born by cesarean. We also know statistically that cesarean mothers have more difficulty breastfeeding. Drugged or drowsy mothers and babies don't bond or nurse immediately, often being put on formula, which becomes then a financial burden on the family. There's also the lifelong health consequences proven with formula feeding. Chronic illnesses like diabetes and obesity come with formula feeding. This, of course, is going to impact higher medical costs for that person lifelong. I want to talk to you about some definitions. First of all, let's talk about normal medical birth. What happens, typically in a medical situation is that we look at birth as highly interventive, using drugs to speed labor, to handle mother's pain. These drugs lead to increased risk of fetal distress, and that often leads to cesarean section. The next definition, normal or spontaneous delivery. This is often what's written on a woman's chart when a baby is born vaginally. This is the birth that's not assisted by forceps or vacuum or cesarean section, but it only refers to the type of delivery of the infant, the actual birth part. It could therefore include induction or augmentation. That means drugs might have been used to start or speed the labor. There might have been continuous electronic fetal monitoring, strapping a woman to bed, not allowing her to move. She may have been on regional anesthesia. There could have even been complications in her pregnancy, things like high blood pressure or antepartum bleeding. This means that all that normal spontaneous delivery really means is that the labor may involve complication or abnormality, but the delivery is normal. The mother pushed the baby out. We want to talk more about natural birth. Natural birth occurs spontaneously without drugs to speed the process, and the mother learns to work with her body to cope with labor without using pain drugs, using movement and upright birthing positions. That is, birth is not made, caused, or processed by humankind. Childbirth is considered to be natural if there is little or no human intervention, and the mother remains in control of her body with freedom of movement. The next definition is iatrogenic. This is an unfortunate term. It means that there's harm done to a person by their medical provider or the environment of the hospital. Now, this could be flat-out malpractice, such as wrong medication given, or other errors that could be made by human error in the medical staff. It could also be something that's done on purpose, such as cutting the vagina or performing cesarean surgery. But even if it's done on purpose, you have to understand these acts leave the mother with injuries to heal from. We'll talk a little bit about risk. Risk refers to the inherent or increased chance of harm to the mother, the baby, or the overall outcome. There are risks to every medical intervention, as well as risks to refusing interventions as well. We need to also understand the word benefit. This is a perceived positive outcome associated with suggested interventions. It's important to respect that your medical team intervenes assuming there are benefits to doing so. However, you need to consider no benefit is guaranteed and every intervention does come with risk. The key really is weighing those risks against the benefits. At the end of the day, what we're looking for is informed consent. This refers to making decisions to consent to intervention after weighing risks and benefits and knowing your options.
The key in this is that the more natural the birth, the less risk of wide-ranging injuries.
Natural versus normal. We want to look at a matter of perspective. So you talk to us a little bit about natural birth.
Okay, when you talk about natural, we're talking about birth as an event, a normal part of human life to be supported.
And in our birthing culture today, normal means childbirth is potentially pathological or an illness, a process to be managed rather than that normal life event.
A natural birth is the work of the woman with the support of her family.
In our culture today, we think birth is the work of doctors, nurses, midwives, other experts. We kind of leave the woman out of it.
Overall, natural birth is where the woman is a person experiencing a life-transforming event to be honored.
But our normal culture today says that the woman is a patient, she's to be controlled.
So birth is an event to unfold.
Not a process of delivery that needs to be rushed. So how to avoid cesareans? First of all, the mother needs to be prepared. Keeping the pregnancy healthy and low risk. She learns how to eat well in order to support a healthy pregnancy, to exercise to keep the mother healthy and fit for birth. Birth is a physical challenge that takes preparation for strength, stamina, and flexibility of the body. Knowledge is power, and educated parents are equipped with the information they need to make the best choices for their labor and birth experience. Birth is driven by hormones, and emotions affect those hormones. The mother's got to feel safe, secure, cared for, and loved for the birth hormone, oxytocin, to flow. If the mother's fearful, anxious, scared, the fight-or-flight hormone, adrenaline, will flood her body, making labor ineffective and perhaps resulting in need for medical intervention. So how to avoid a cesarean? You avoid the cascade of interventions. Be aware that routine medical protocols and interventions are often used to speed the process. They can lead to complications, which lead to more interventions to correct the effects of the last intervention. Understand, research, and ask about the risks and benefits of all interventions to make informed decisions and seek a second opinion. Shop for a supportive doctor or midwife in birthplace. Don't put the expectant mother in the hands of a care provider who relies on interventions to manage labor and doesn't support natural birth. Calm the mother's fears of birth. Learn natural ways to cope with labor pain to avoid her request of pain medication. This oftentimes is the first intervention when the mother comes in asking for pain relief. It leads to the cascade of other interventions. Know your rights to refuse interventions, and that you are the one that's going to live with the outcomes of any intervention, potential risks of harm, and ultimately you're responsible to make decisions to submit or refuse. We really want to say, learn to use your brain. That means benefits. Ask about what are the benefits of this suggested intervention. Risks. What are the risks? Do we have any alternatives? Have you thought about what your intuition says about this, or have you played a staccato? And think, what if I do nothing? How long can we wait to decide on this intervention?
Also, to avoid cesareans, we need to talk about the support person.
Absolutely.
The husband preparation. Ensure she has support from her family, especially
the husband.
Make sure no one undermines her journey to natural birth. Those closest to her should also be educated about the benefits of birthing naturally and the risk of unnecessary medical interventions. There are choices to consider and decisions to be made during the mother's most vulnerable moments. Be prepared to make these decisions with knowledge of options and informed consent, rather than referring all choices to someone else, who may or may not understand the value of birthing naturally. Be determined and know your rights and options in childbirth.
That's really key.
Explore VBAC. Increasing rates of cesarean are in part due to repeated cesareans. Therefore, avoiding the first cesarean is vital. If she has already had a cesarean, how about the VBAC? Know that vaginal birth after cesarean may be an option.
It sure might. It's preferred that she has 2 years between a surgical birth and attempted VBAC, and the risks are lower if she's had fewer prior cesareans. 1 prior cesarean is less risky than 2, which is less risky than 3, and so on. But typically speaking, the VBAC, or the vaginal birth after cesarean, really is less risky than the repeat surgical birth.
And consider the reasons for the first cesarean. Are those factors present this time? Were they valid reasons to start with?
Great point. And then some doctors will tell you you're not allowed to have a vaginal birth after cesarean, but you need to know it's your right. It's your choice to try. No doctor's going to come to your home to do your surgery. You have to decide to show up for that appointment. It is our opinion, though, that VBAC mothers really need to commit to no drugs during labor, no drugs to start or speed the labor, no pain medication in labor. You can also join forums for VBAC mothers such as ICANN, International Cesarean Awareness Network, and Special SCAR for evidence-based information about pursuing the VBAC.
Let's talk about childbirth education. Read and research to know your options.
Yes, and enroll in live birth classes, AMANI birth classes. We know that the birth experience affects and matters to the mother and the baby lifelong. We really believe most women can birth with minimal medical intervention. In fact, the World Health Organization states normal birth needs only close observation from a trained professional to detect early signs of complication. It needs no intervention except encouragement and tender loving care. We'll practice natural pain relief techniques in your class. Knowledge really is power, and this leads to informed consent. Satisfaction comes from decisions made with knowledge. Overall, you have healthier pregnancies, less complicated labors, and better outcomes when you take AMANI birth classes.
And this includes the support person, the husband, in the indication journey.
Absolutely. AMANI birth materials are available in English, Arabic, Bahasa Indonesia, and German. Thank you so much for joining us today. We hope that you have a pleasant birth.
Thank you.